my name is Angela Blankenship, and I will be doing a video over the clinical tasks such as identifying and doing different routes and going over the different animals such as a rat, rabbit, and bird. And my number is 305-4406, and this is for lab animal management. Rats should be given water whenever they want. It should be at their disposal, normally in a dropper, so they can get it as quickly as they want it. And then the food they should be given, most rats can be given food and left out all day, or some have to be given specific quantities because they can overeat and become obese. And then you can give them vegetables and fruit, just make sure that it is washed beforehand. When restraining a rat, you do not want to have it up in the air and suspended for long periods of time, and you never want to restrain it using it from its tail. You can place 2 fingers on the thorax behind the elbows, gently pushing forward, and then always have the tail restrained as well, and you can do that by putting it between 2 fingers. Female rats are continuous polyestrous, and their estrous cycle is 4 to 5 days. And then they hit puberty about 37 days, and that the male genital papilla is a lot further than the anus and on the female, and in general they are normally a little bit bigger. So on this is a female. Alright, to administer a subcutaneous injection on a rat, you'll need to keep them on an elevated surface and not just on the floor or in your lap. And then you'll want to scrub the skin behind the neck and have it tinted, and then hold the needle at a 90-degree angle and slowly inject it into the subcutaneous matter below. Sometimes rats need to be giving oral medications, and so sometimes when they're ill, so you want to use a small ballpoint needle pin on a syringe and firmly restrain and slide the needle on the soft palate until it reaches the esophagus, and then slowly go down. Alright, so we're going to start by bleeding the tail, and so you want to prepare it with alcohol by wiping it and then allowing it to dry. And then you want to get a TB syringe and a butterfly needle. And then you want to do it about 1/3 to 1/2 down the tail. Mobilize the tail. Press down. I can't see that. And then when you do it about 1/3 to 2/3 down, or halfway down the body, and then you do it at a slow angle, and then you pull the blood. Slow. And that's how you pull from the vein. Alright, mice need water all times, and then their food can include the pellets, which should be about 16% protein and 4 to 5% fat. You can also include fruits and vegetables in their diet, and that can include apples, bananas, peas, and berries. Avoid feeding them seeds or grains because that can have too much sugar and fat in their diet. And if you do decide to change their food up, you want to do it over a gradual period of time to create a GI upset. Rats should be restrained from the base of the tail, the proximal end about 1/3 towards the body. Due to their size, they can be vulnerable to physical harm. So you do want to grab it by the end of its tail, scruff it on the back of its neck, and it is able to be examined. On the mice, the genitalia is further away from the anus, and so for the male, and the testicles have descended, and this looks like a male. When giving the sub-Q injection, you want to scruff the rat on the back of its neck, making a tent, and then do the injection in the scruff. When giving an IP injection, you want to flip the animal over and make sure that its body movements are doing fine, and then you want to do the injection in the bottom right or left corner or quadrants of the abdomen to make sure you avoid hitting the bladder and the liver and all of the other organs. So you'll just do it. Sometimes when you have to give medications to a mouse, you have to do an oral dose. So you want to get the needle and put it at the top part of across the palate, and then slowly inject it in. Alright, rabbits should be given water by a hanging mechanism and food as well, but I have the food in the bowl. And the food can be pellets or hay, and then raw carrots are also good, but you don't want to give them too many. Rabbits should be kept on a feeding schedule or they can become obese, so you don't want to leave the food in the cage at all times. Their diet should consist of about 15% protein, about 10% fiber. You can soak Timothy hay in papaya juice or pineapple juice a couple times a week, and you can give them a diet with a little bit of raw carrots, but you don't want to give that too often or it can cause diarrhea. When restraining a rabbit, you want to use care because they can hurt the restrainer and the person and themselves, so you want to make sure their hind limbs are always restrained or they can inflict pain on the restrainer and themselves, and they can damage their spine. So when restraining, you want to hold them in between the elbow of one hand and the other hand is restraining the hind legs. When sexing a rabbit, you want to squeeze gently on the genitals, and if there's a slit, it's a female, and if there's a penis, it's a male, and this is a female. When injecting sub-Q on a rabbit, you want to do it on the scruff of the neck. So you want to scruff it, make a tent, do a small needle, do it at a 90-degree angle, and inject slowly. Cool.
You're through it. A little bit of suction. There you go.
When obtaining a bird out of a cage, you want to keep the area quiet and calm so that the bird doesn't get stressed out, since they can get stressed out easily. On smaller birds, you can use paper towel instead of a normal towel, and then you want to slowly go up behind it, wrap its body around its wings, and allow it to chew on the paper towel so that it can keep its beak busy. When performing a nail trim, you want to make sure that you don't get too close to the quick. On light colored nails, you can see the blood, but on darker ones, it's harder to see. You can obtain the data by looking at the bird and observing it by the way it's walking and perching and how the respiratory rate is. So as you can see, the respiratory rate on this bird is normal. She is not moving and not walking, so she is just content. Okay.